Let's consider a situation where a patient asks you, as you being the operating dentist or the family dentist, that what should they eat. You have advised them not to take lots of sugars, and that will just promote cavities. But now they are asking the very specific question: if not sugars, then what do you advise them to eat? Now, here is a thing that I don't want you to be a dietitian for them, but just give them a general overview of what is a balanced diet and what is a healthier diet that you would recommend. I understand that there are a lot of things to consider, but just to make things easy, I will just show you a diagram, a picture that has been taken from Harvard's website, and that will just give you an idea how the meal should be proportioned, and attention should be paid to the quality of the meal, quality of the content of the meal. It's a good idea to eat fruits and vegetables, but in what proportion? So, before you look at this diagram, look at the center picture here of a plate, and that will show you the proportions or the amount of a particular thing that should be there, amount of particular eatable that should be present in the plate. So before you go ahead and read the text, just focus on the picture itself, that if you look carefully, fruits and vegetables do form half of the plate. And when we talk about vegetables, the more veggies and greater the variety, it is the better. Now, we will advise that potatoes and French fries should not be counted as part of the vegetable proportion of this plate. When we talk about fruits, it is advised to eat plenty of fruits of all colors. There should not be any discrimination among the fruits, and all the fruits are acceptable when we plan our diet in a healthier way. Now you know that whole grains do form a part of the proportion of the plate. But what kind of whole grains? So here is an idea about what kind of whole grains should be advocated. And we can advise them to eat a variety of whole grains, and that could include whole wheat bread, which is brown bread, whole grain pasta, and brown rice. And they should be advised against using refined grains like white rice and white bread. This is just an idea that whole grains do form a quarter portion of this plate. So keep in mind, vegetable and fruits form half of the plate, and whole grains are and healthy proteins are forming a quarter each of the full plate. How about proteins? Now we know that proteins are healthier, and we now also know that proteins are forming one quarter of the plate. So, what will you advise here? And the choices are between having fish, poultry, beans, and nuts, which will provide the required amount of healthy protein. One should be advised to refrain from eating red meat and cheese. That could just add the cholesterol components to the diet, and one should be asked to avoid bacon and other processed meats which are packed up and have been refrigerated for too long and can be bought from general stores. So those kind of meats should be avoided. So this was all about the proteins being quarter part of the plate, which is part of our healthier diet that we are considering here. Special attention has been given to the intake of water, which is a part of our healthy diet, and the reason is here is that we want to make water as our favorite drink. We don't want to drink sugary beverages all the time. So it is advocated that water should be drank along with tea or coffee, but obviously sugar should be avoided. And when we talk about milk and dairy products, should not be exceeded more than 1 to 2 servings per day. And if somebody wants to have some juice, that should be restricted in quantity as well. So that should be kept up to one small glass per day and not more than that. The idea of mentioning the diet plan to our patient is that so they can focus on the quality of the diet and not about the quantity of food that they should have in their everyday life. We also encourage a patient to use healthy oils, and we are not recommending a set amount of calories that they should have every day. Doesn't matter what kind of food they are taking. It comes down to having those calories from healthier foods, and that's why we are recommending the choice of using healthier oils. Just presenting this picture one more time so that it builds up an idea that how you are going to uh, deal with the situational scenario in your exam. So any patient who is asking you for advice, or if you have to give an advice to a simulation where an examiner is a simulated patient, so keep this colorful plate in your mind that has been divided and proportioned with different sets of contents, and keep an idea that vegetables and fruits stay on the left side forming half of the plate, while grains and healthy proteins form the other half with a quarter proportion of each. And adding to that, a patient is advised to drink water and advised to use healthier oils in the preparation of their foods. To conclude this lecture, we now know the importance of a healthier diet and what set of contents will form a healthier food plate, which will include fruits and vegetable forming the half of the plate, while the other half will be formed by whole grains and proteins, and adding to that water and healthier oils. So now you can deal with any situational scenario if you have been asked or will be asked in your situational judgment exam, OSCE exam, or any live scenario.